Welcome to my YouTube channel. My name is Amu. I'm an RN works in Toronto, and today's video is about iron deficiency anemia. So if you're feeling off lately and you're feeling tired, you're feeling lethargic, you feel dizzy on and off, this video might be for you. You might have iron deficiency anemia. So let me break it down for you. What is iron deficiency anemia and what the symptoms, the cause, and how to diagnose and the treatments. So we women, most of us suffer from iron deficiency anemia for different reasons. But for me personally, since I was a teenager, since I started to bleed out, I do have this iron deficiency anemia and I have been taking pills on and off, but till today I have these all symptoms. As per the studies, most of the women have iron deficiency. So more than 1/3 of the women under 50 are suffering from iron deficiency anemia, which making it most common nutritional deficiency worldwide. Women, it's a part of our life to be not having enough blood because we bleed every month. So it's not really a new topic for us, but let me break it down for you. What is iron deficiency anemia? So iron deficiency occurs when you don't have enough iron to produce hemoglobin, which is a protein in red blood cells which carry the oxygen to the brain. When we talk about iron deficiency anemia, I have to talk about three main factors. Number one is ferritin. Ferritin is a protein that stores iron in your body. When you do a blood work and your ferritin comes low, which means you don't have enough iron reserved in your body to produce hemoglobin. So when you don't have enough iron, there's no enough HB. So when there's no enough HB, not enough oxygen is going to your brain, which further cause your lethargy, you're breathless when you do some kind of activities, you feel tired all the time because there's not enough oxygen going into your brain. That is iron deficiency, which means you don't have enough iron in your system or enough iron is not reserved. So eventually, if your iron is low for the long run, the production of hemoglobin will eventually get lower, which means in the long run, you will end up having iron deficiency anemia. This iron deficiency anemia we mostly seen in teenagers and women who have heavy menstrual periods, plus who have some kind of restrictions on their diet. Let's say they're vegetarian or they have a strict diet which avoid most of the food items which have iron in it, then they will be deficient in iron. Most of the time, when you go to a doctor to diagnose iron deficiency anemia, they can just easily diagnose the issue with your HB level or your iron level. But most of the time, doctors find it very hard to understand why that person have low hemoglobin. Because every time I go to the doctor and I ask why this is happening, most of the time they don't know. But I know I have heavy periods. Most probably that is the reason. But it's a mystery why I don't have enough HB, because it's a common issue in women's. Honestly speaking, doctors tend to not go deep into that. They will just prescribe you some iron pills and you just have to take it for 6 months and it's again go up. But the problem is, you take medication for 6 months, it works, your HB go up. Again, after 6 months, if you stop the medication, it's going to go down because something is wrong inside your body. But finding the cause for the low HB is very tricky and most of the doctors cannot be able to do it, but I don't blame them. Most of the women's issues, they don't really have a research on it, so I don't blame them. But main reasons for low hemoglobin is the heavy menstrual periods, or you have a restrictive diet, or you have a gut issues. When you have a gut or intestinal issues, nutritions on your food may not get digested properly or get into the system, so you don't get enough iron through the food. Medical conditions such as celiac disease, Crohn's disease, or if you have any ulcers and bleeding and you have any kind of internal bleeding, which will reduce your iron level in your system. These are the main causes of iron deficiency anemia. People say who have iron deficiency anemia, once you take the pills, eventually your HB will go high and you won't have anemia, but I don't really believe that. I do have iron deficiency anemia since I can remember, since I was a teenager, and I am 32, I still have it, and I have people in my life who have iron deficiency anemia from their teenage life Now they are 60, till now they have it. Every time they check their blood for hemoglobin and iron, it's always low. Even after taking medications, even after having the diet which have iron in the food, still their iron is low. I think once it's get into your system, it just have to manage to prevent the symptoms by taking medication and food, but it doesn't go away. But when it comes to the diagnosis of iron deficiency anemia, usually when you see all these symptoms, the first thing you should do is go get checked with your doctor. 100% of the time your doctors will do a blood test on you to see how your ranges are. So most of the time they would do CBC, which has HB in it, so you will get tested for HB. Most of the time knowing your HB will help them diagnose your iron deficiency anemia, but I would recommend you to ask your doctor to put ferritin and iron so you can see where the issues lies. So these are the 3 blood tests you would be doing to find whether you have iron deficiency anemia. So now let's talk about symptoms. So that's an interesting factor for me because I can just close my eyes and say the symptoms because I do have every day. So the main symptoms you might feel is you feel dizzy. Dizziness is one of the most common symptoms. Pale skin, shortness of breath, hair loss, cold hands and feet, fatigue, dizziness, brain fog. Whenever I get brain fog, I know my HB is going down because otherwise my brain is kind of okay. But when I get this brain fog, I knew I have to get checked and I need to maybe start taking the medications. Let's say you have an iron deficiency since you're a teenager. By the time you're in your 30s, you're kind of very knowledgeable in iron deficiency anemia because you had it for almost more than a decade. Then you understand when a small change happened in your body, you know that, oh, it might be my HBs. Understanding our body is a blessing for us as women because a lot of things go south and north with our bodies, so we just have to be mindful. Treatment, most of the time you could do a blood test and your blood work came, your HB is low, your iron and ferritin is low. Most of the time your doctor will prescribe you an iron pill which help you to increase your ferritin level and hemoglobin level. So that's one of the most common treatment most of the doctors suggest. But the issue is this freaking pill has a lot of side effects: stomach upset, constipation. If you already having gut issues and you're taking iron pills, so that's very tragic situations, but you have no other choice. The main issues I had faced when I was taking the iron pill is stomach upset, nausea, and constipations. Almost all the iron pills will give you constipation, but I'm taking another pill currently and which give me less constipation, so that's kind of a win-win for me. I can put a picture here, the one I'm taking, so maybe that's gonna help you. I used to take the ferritin tablet, the red one, this one, and that used to give me constipation so badly. So I talked to my pharmacist at work and she suggested me this one, and this is actually helping. So whatever your doctor prescribed, just go for it. But if you see really bad side effects, maybe you can go to talk to a pharmacist and see if you have any other option. If you're taking the iron pill, you have to at least take 3 to 6 months to see the improvement. Second thing, most of the time, what doctors recommend is the dietary changes. You have to try eating the foods which are high in iron. The foods such as pomegranate, kale, spinach. Spinach is one of the best option for your iron. Beans, different kinds of beans when you eat that has a lot of iron. So red meat, which is mainly beef, is one of the main food item which has so much iron in it. So at least every week or twice a week try to eat beef, or you can eat every day, but you just have to be careful about the uric acid, but otherwise you can have it every day. One of the food, try to accommodate into your diet every single day, and then that's gonna eventually help you to have more iron. Most of the red meats have iron, so you can take beef, salmon, liver, chicken liver and beef liver is a really good source of iron. You can find a lot of food which has iron within your dietary choices and start having that every single day, at least one of the food items, and which will help you maintain your iron to an extent. If any of these two about to explained remedies doesn't work for you, then the next options the doctor will suggest you is iron therapy, which means IV iron. They will inject the iron through your veins, which will help you have your iron get hiked up so fast. But I never did that. My doctor has recommended for me to do it, but I didn't have the courage to do it, so I'm still holding on to the pills. But eventually, I think I have to get it done, because if you're a woman, you have to go through the pregnancy, you have to go through a lot of things which you need enough hemoglobin in your body. So if none of those remedies is not working, the next options you have is going for the iron infusion. None of the above mentioned remedies doesn't work for you, then again the doctor might have to look deeper into your system to see if you have any other internal issues or internal bleeding, which will they have to fix through surgeries. If you have any internal bleeding or chronic issues in your system, then they have to do some surgeries or treatment for that to reduce the iron deficiency anemia in your system. In severe cases, they do blood transfusion to boost up the RBC in your bloodstream, but that is kind of the last remedies they usually suggest. If that's a severe issue, severe case, then they do suggest blood transfusion. So that's all about iron deficiency anemia, and I hope this video helps at least some of you. And remember, you're not alone. Most of us women do suffer from iron deficiency anemia, which is not a good thing, but we don't have any other options. Our body, we have to support our body, we have to understand our body, we have to realize what needs to be done. So understanding iron deficiency anemia, getting diagnosed and starting the treatment as soon as you can makes a lot of change in your life. So if you have any of the symptoms I mentioned in this video, go check out your HB and iron level. Thank you for watching my video, and see you on the next one.